Am I experiencing false pregnancy? What are the signs of pregnancy? How can I know I am pregnant? Good day, everyone. My name is Gwendolyn Hale. I'm a seasoned and certified medical microbiologist, and I'm popularly known as the medical professional with the difference because I bring you knowledge on health and a lot more, and I do it like no other. In today's class, I'm going to be teaching you 24 signs of pregnancy. But before I go there, if you are just joining this channel, don't forget to like, to subscribe, and turn on the notification bell. And if you're a returning subscriber, this is me saying thank you. Welcome back. So we're going to dive straight into this topic: 24 signs of pregnancy. Number 1, missed periods. Menstruation is not a proof of ovulation. You can menstruate, but you don't ovulate. So this is to say that every woman is different. Let's go into our next point. Point number 2, breast tenderness and swollenness. Your breast becomes tender, especially your nipples, and they begin to grow in size. The third point is nausea and vomiting. Nausea and vomiting is a very common sign of pregnancy. In fact, nausea is, you feel irritated. In fact, you feel like you want to vomit all the time. So they work together, nausea and or vomiting, because most times you can be vomiting but you are not nauseated, and you are nauseated but you don't vomit. So it's nausea and or vomiting. The fourth point is frequent urination. That happens in a few women, but I'm telling you that is a very common sign of pregnancy. The fifth point is mood swings, change of moods. All of a sudden, you just feel moody. You just feel sad. You want to be alone. That's a sign of pregnancy. The sixth is low sex appetite. You will start noticing that if you're with your partner, you will not feel like having sex. You know, you want to be on your own. You know, so you're feeling somehow. In fact, progesterone is so high in the body that estrogen has dropped down. So you are so much interested in being alone, being a boy. You know, estrogen is more of responsible for sexual activities. Estrogen, not progesterone. Progesterone is more for pregnancy and menstruation, while estrogen is responsible for sexual desires. The seventh is light spotting, and this light spotting is normally during the first trimester, and that is known as implantation bleeding. When the fertilized egg wants to implant itself in the wall of the uterus, it actually causes this light bleeding known as implantation bleeding. It's also known as a light spotting. The eighth point is cravings. You'll find that you'll start craving for some particular foods. You don't know why. It could be a sign that you are pregnant. The ninth is increase of heartbeat and pulse. You will notice that your heartbeat will beat faster, and also your pulse will be a lot faster. And most times how people would know that you are pregnant is that they will look at this area here and it is beating fast. That means that you're pregnant. That is a sign of pregnancy. The 10th point is slight increase in blood pressure. And this is because of the increase in blood flow and contractions, the increase in contractions of the heart. So there'll be this slight increase in blood pressure. And the 11th point is no ovulation. If you take an ovulation kit from the pharmacy and you test for ovulation, you will not be ovulating. And the 12th point is an increase in body temperature. Just like when you are ovulating, you have that increase in basal temperature. When you are pregnant, those first trimesters, you have a slight increase in body temperature. And the 13th point here is pregnancy glow. For the first 2 months or the first 1 month of pregnancy, you have this radiant glow, which is due to the increase in blood flow in the body. And that actually affects the skin, the radiation of the skin. It makes you look more radiant and glow. But these radiance fade away when it comes to the 5th or 6th month of pregnancy. The 14th is increase in prolactin. Your pituitary then secretes high levels of prolactin, actually preparing your body to breastfeed the baby. The 15th point is acne or pimples. Many ladies experience acne or pimples during pregnancy or during early stages of pregnancy. The 16th point is hyperpigmentation. That is, some ladies have their neck dark, their armpits dark, in fact, their genitals dark, their nipples start getting dark, their tummy starts getting dark. In fact, the areola becomes wider. In fact, it becomes more darker and begins to widen. They have a more production of melanin, a high rush of melanin production during that time in certain areas of their body. Now, the 17th is weight gain. You start noticing that you are gaining weight. And this is not because of you eating. You just notice that you feel a little bit round. Your thighs start beginning to come thicker. You feel a little bit heavy. That's a sign that you are pregnant. The next is nasal congestion. That is the 18th point. Nasal congestion is very common with ladies. It has nothing to do with if you are in a dusty environment or if you are in a cold environment. You just feel a little bit stuffy in your nose area. The 19th is morning sickness. Around the first 2 months or 1 month of pregnancy, you will feel tired. You want to sleep. No matter how long you sleep, you are still tired. And you will eat a lot during that time. Trust me. All you want to do is eat, sleep, pee, eat, sleep, pee, eat, sleep, pee. And the 20th is increase in breath. You will notice that during that time, you'll be breathing real fast. Your breath rate would increase. You'll feel like you need to breathe extra. That's because you're breathing now to send oxygen, not only for yourself, but to the fetus. And the 21 point, bloating. You will feel bloated. And the 22nd point, constipation. Bloating works with constipation. You will feel bloated and constipated. No matter the laxatives, no matter how much fruits you take or how much water you drink, you will still be constipated. Those are the signs of pregnancy. And the 23rd is lower abdominal pain. Slight abdominal pain. I'm not talking about intense. You will feel uncomfortable. And sometimes when you haven't even noticed that you're pregnant and you're going about your daily activities thinking that everything is okay, you start feeling this sharp pain on the side of on your side, on the lower part of your abdomen. This sharp pain that will make you know that you need to go to the hospital. But it's slight, it's not very intense, but this sharp pain on one area that will make you go to the hospital. Your body will want to tell you that you are pregnant and that you should focus and sleep enough, focus on me. I'm here. And the 24th point is you do a urine or a blood test to confirm that you are pregnant. You can do the urine test by yourself. Go to the pharmacist, buy a pregnancy test kit, and then you do it. If you see 2 strips, then that means that you are pregnant. Or if you really, really want to go further to confirm again, go to the hospital and do a blood test, or you can do an ultrasound, and then you'll be confirmed that you are pregnant. I would like to say this. Don't only pick 1 or 2 of these signs I have given you to confirm that you are pregnant, because these signs that I have given you could also be the signs of another underlying disease or infection or health complication. So I am going to advise you, take 4 or 5 of these signs I have given you and try to see if you fall among. Because some of these signs could be common in some women while not in some other women. So pick out 4 to 5 of these signs that I have mentioned, and then you will know that you are pregnant. So enjoy your pregnancy journey. And if you weren't expecting this pregnancy, if you're unmarried, or even when you're married, please, I'm pro-life. Do not commit abortion. I did a video on abortion. Please look at it. The complications of abortion. Please look at it. Abortions do not directly affect your ability to have a child in the future. You can still have a child in the future, but it's the complications that arise with abortion. Till next time, I remain your seasoned medical professional, Gwendolyn Halle. Bye-bye.